That's the problem now. But Maame bisa we na yenko the topic. Do you feel that? I personally feel that anka first aid and I say oh dodo kakra anka esa akola 2 years kra no dodo na ohu ni esa onye. Anka wohu sa education no I feel say anka yemfa ma wo school.
Yeah.
Na ohu like tipaye sa nyaman kitinkiti bi na ko bia wo basic knowledge when it comes to medicine and as a health.
Yeah.
Why don't you people infuse this into our system? Why don't we train people or focus more on preventing us getting to this level? Before we get to this level, then we make education up. We talk or give education about this. Why don't we start from the root?
I think that is why you program here. Who say education. Sometimes you do go to schools, churches, mosque. See, like I said, maybe area pass many or no that area no. Enti sebeya at every point in time we my dear baby because now topic about se be hu sem crofo abuse in Europe and a problem see enti education ho ba say say medicine abroad treat health abroad enti omo awo yen line no so prevention medication prevention and then
those who are giving the medical system no holistic approach or other things
omo women no ukwa be hwa mo don do so chen yen sa line for no
why is it so because when you go to China they believe in like they do more in preventing the things holistic, from coming the holistic they do more herbs and so why is our case different and as Africans
me can say be the passion the interests based on the individual choices but ye say nyankrofo a omo so promote health ne pa I think that is good. But make us a general in the for passion, ebesibia or track consulting room or main or any pipe or surgery. But people are also coming out. They also want to push that agenda. Say you're indicating for your church and one bay area mouse, and I think that is essentially good. So we are going to get there.
We are going to get there gradually. Banka ye the school, I won't say
yes.
I call work class 1, class 2. Me has started
more education.
Is there a way we can do this?
Yeah, we can do it.
So why are you not doing it? If you have been to the classroom,
yes. It's yanka wasem na yen try to also encourage people. And now there are even NGOs near there a come health talks with doctors near some community. People are doing but and ma lamplight ni more.
But you coach classroom now.
Of course, a bit me abwa. And you point to schools, churches anyway we educate and we talk about prevention. And you be interested other health staffs no nurses, pharmacists omunina in promoting health and you depend what to do.
That is if they will. You are watching the biggest and the largest Orthodox medicine. Is it good or bad?
Well, I would say you see, every drug I will take no. I don't want to be biased. Every drug I will take no. Effect bro. It's not one me drug. Was so careful. And I also advise my doctor and trauma. Yes, because every drug I will be the good side and the bad side of it. Into other herbal, Orthodox, natural, whatever, I will take I also am mindful of it. Because the can say druna no e pata e ko boy pata ntina ya na ye tro ho side adverse effect between their bro. Nti do be onum bia no know that ntina more time limits. That is why it's bad to do self medication. Nti I wouldn't say Orthodox medicine is bad or good, natural medicine no. But then be careful and cautious as when you take it. A dribble 3 days per no. You go have just 1 day. So don't go about abusing medications. I'm
asking this because I think we have a lot of herbal medicine. A lot of people are putting a lot of things together here. But when you are going to register it, they are all taking it. They will tell you that Food and Drugs Board has not approved of it and blah, blah, blah. Meanwhile, there are medications that you approve it, but you will still take it and have issues about it. So that's why I'm asking.
Yes, so our issue now is globally, for natural medicine and Orthodox. Yes. Now the thing is with herbal medicines, your problem your control. And the structure side being ye. Obekona obi ye drew no you know or your da same. Da same no metal be ko drew no be ha wadwen. Be kokko bi o ye drew no environment na o ye no. If any ball or no ye drew. Do a drew might be good, but the environment will cause pollution. Am drew na nyadwuma. I remember say research be drew bi ankofo bi no mo ye no. Omo de ko nikanika na metals we do na say. and we have to discard said running now because nipa kono my mom impenti say you tumi regulate streamline here of course impact and so deba I betumi aboa but once ujemu people abuse it, people do concussion mixtures, and it also has impact. Sometimes on farm measurement ground to home, with me to an ground because I have medicine, and that's a problem. Until I regulated, NASA the your mobile food dry extra 2 days, this meal, this number of capsules. I think it's too basa, because I know say KNUST there's a herbal medicine unit, say education in our also any other institutions. Indeed, yet Miss Chumlani na YouTube modern say be ma monitoring akoswa because we know jano so most of the time you call overboard nti yensumla ni ye niemwa say be ya no so yenko abuse no na fe betumi aboa kakra.
I don't want to ask more, if not I will get into your time because so if you talk about metals, all the cooking utensils we use are metals and we are still eating it.
Exactly.
So if it's in the medicine, is it not the same as documents?
Oh, say you see the point is when you are say bia wo di mole quantity of media come and say we nom a draw maybe 500 ml a different. This is food and this is a draw they cook with you. Do you understand? And you are now you might add other ingredients which me but the draw there obota say the cook with some condition. However, the metal condition metal na woman will be able to also affect it. We advise them to maybe use a draw no but maybe a munsin or drum.
Maybe a munsin will.
Aha. Did you get the point?
I get to the point. If I know one will cook.
Aha. Do you understand? Yes, we educate even with Sanyani our canon. See, I'm advice people say, don't eat when they do with the benkum because with the benkum more metal small because a funny can more.
Now, some of father the same.
That is it. And if you know, I say, "Koyam." Inti that the journey many media PC and a dia PC. It's now with the mutu benkum. It's done the journey. Chebasa the problem woman no. Enko mutu enko how again. That's the point.
The other day in class, ne can't say me now. You can't about plastics in so I the plastics the things that no kidney issues because when you start drinking and you don't know what you are consuming then so ni go na what plastic nimu. How did we get here as black people?
Yeah.
How?
So she says she has no Maame Grace acquire more of economical issue be a pesca. Oma dream pum den home from a few will be a business is about money. Inti on her say plastic not a dear we also such a we also he doesn't care. You hear say betonya nisika. And say acquire more of saying na siska we don't care what happens to each other. A problem ba no.
And papa.
Yes. Inti I say oh ya bia many pay you so no more na we dia think about the health.
At the beer open no you think about the so first. Ntro wa pro tomatoes are pro. At the not sell the basic quantity. We love money than ourselves.
Sure.
Hey, asemo we dey say be kan abosom beso nti we dey me fancy an yenko the topic ni not all genital discharges are not discharge it's infection or say nya bibi e so ni so ni so bia na eye yarewa nti the edi kan doctor please define what infection is. We must understand that word na afa ye hu discharge no so genital dey say obi anim wo ye oba unim me koka se o mbeka se me ye we wo ye oba eye pussy wo ye oba ma eye dick me koka ni twi di o mbeka se masai kora nti ene me nka but dem ka kakre say eno so nyo da sorry eno dey ye nim genital but what is infection and what is discharge?
All right, so kind infections are yaremwa eba yemu na enye the bias no kwa ba hu say nso gu no kwa even ulcer infections, typhoid infections. It's infection eguma hodro ne momu no ye pese na charge ne ko genital one de no de ye ba na ye be ma no ho de no na ye pese hwe pa. Infection generally means say yaremu bi aba mu, even malaria infection parasite so bi aba mu na e abo na de abro e be cause germs and a microorganism yes when your infections into your baby by the brain in your best here the kind genitals no a bar was bema was no and your cast discharger in so free or bani maso or bema ni eba and your person cast be bisa in so gua and just when your infections that's what to boase na uja say hu ya no koto aduru na wonom and that's the problem today and then for abuse antibiotics no be do no yen antibiotics pa kra ncho obi so nkotonom because a money the can who or no man fa a money already train drone say mra e ba obetwe akwese ya bo akra na obebo na fide on fa ho biem nti e money hunu no sisi e say baby edu o wi asem no e fa de bi antimicrobial resistance one fighting run to be anom na no be sani no anom hwe no just one we na sit from obium one no mapem nti e basa na very problem and the issue a man krofa business no na say dey you hu say nso gu na any infection no akọ draft no akọ pharmacy na onum no and that is where we are today the person e chim na nipa nya light hu so discharge bia hu bia no to bo ahye na infections.
Okay, discharge, I think you have to I think so you have to take your time and explain types of discharge yehu ewo yewe no because when you are sleeping with somebody you discharge both people. When you play with yourself you can still discharge.
Exactly.
So tell us which type I mean types of discharge yehu nia yehu ni say yare dia yehu ni say your body now for me ye dia yehu ni say where the be wrong like I mean give us types.
All right, okay. Inti yenhwe the entire ohaw no now your chlamydia infections boy be friend trichomonas mean can first me coach we inti trichomonas it me the sa chlamydia infection ne ba na your gonorrhea na serious gonorrhea ono so to be gonorrhea ne ba so nya syphilis and more discharge the for kwata confuse pa common ones by gonorrhea and chlamydia no now your a mouse dey ba ko a e tar friend no bacteria vaginosis and also ho any trichomonitis and also ho nti these are the common infections a time nya discharges both a man and mema na yinti ni pa say yes infection ya make kan bia empempi no nso na eba no e ya na greenish kakra light greenish ebi oni tun brown kakra ebi okwa yellowish na ya na thick then again na san bon pa nso ase kusuya ase nambia so who say there it is telling you say it's an infection even that one I also plead say laboratory and our conclude doctor on show na koye sa test na confirm ni ehwe now ebi o nso a obehwe na ebi sometimes no wonya kan da hyehyɛ no so man ntuminya ene efe no deep one as white no it's because of the charges no and initial no so pa say infection apart from say yes our colors ya making na fe e born no utanya painful urination one obema kra na obeshi out pains say ebia o sperm se ba na obema hu sa pains no nti saa de ye yare no it is accompanied with this enema e ka ho ka bom nti oba consult na ya na e do history bi so questions be brave asa na etumi hu say we na say that never but who discharge na no form ya do otimi say yare by wada nema ye hwe bisa ehu then we take the process from there ni diagnose ehu nti so hu emu bi ye pampan e bon ye eniye green kakra eniye yellowish kakra sometimes no pains and our sensations our say ho hyewa ene ma me grace e kire say yare bi abo bi na aba ho ene e hawo ni akola ni akohwe de me kan ye bi say you go no white bia chlamydia then we take it from there.
Question baby said they are no kakra because what we say we didn't know tuberculosis, malaria, measles, HIV. I can mention and mention and mention. We were here. We didn't know about any topic one any. So niama obobo mboya obobo mudi na unso mu no mu ni twedi. Abrofudi no.
Yes, why?
If you hina bedu ha. How? Because anytime a sickness bebe bia or the abrofudi if you ho na e ba omo aso no mo wo na duru. Na e ba so beto ye wo ha enko biom na abeka. Yare na weibo na aba na abeka. Weibo na aba na abeka enko da.
Yeah.
Eye nkrofo na create yare no. Ana so say enduane ayedi so wo bacteria sibum ana bacteria wo nti enu emmoa wo aduane na ayedi nti enu so na create ana say dem because me person me tia say dem tia
say ye hwe yare mu na e kana apart from white no dia kan na ye nem yare and don't more if you say if you best 90s ni ba na we say globalization kakra you took one ye fa ha ye ko haba nti mo na ye di nkita ho na ye di dwa no na ye san nya nam nkita ho die frafra no ene ko sade no
ya ko twetwe ne man ba
tsenke bia nka ye ne atiga ne ntukwan a ke ne be ye den se de ken then we can look into it so the be na share that be share baby na ye ko fa na be wo ye ana
ye tu kwan bo ne yan ko hye so a
be here is the case say Ghana ni okro bia biase baby benya Ghana ni ho
of course
yes enti by so doing you know e ya na to contract and at the ten say oba no ye nso settings na ye be ka say almost nka ya de nka de pa ne local medicines no Orthodox medicine na use any few about 4 never. Into her laboratory devices never be ready ya e be organic for never. In no be na ho never. Nti research a do I dey hu no. E ho na pempinye tae no. En say Cosbee across South Africa and UK. Nti wo hwe research here was our countries na. E na kon kan kwa anim chen dey wa ha no. Nti ho na me hu some of these things. And na you know say na kwa nipa muja kona wo yum nti aboa bi kamia broni so nipa wetuma nya sa aboa na nti etumi de man ho because of say na the same human beings homo sapiens no. Nti meka ne say nipa frafra ne akona bedie ni enam kitahudi ekoso no ene ma nya dwane di nti obetumi ka so one oba bia nhia da okodware nsuo ni ade and infections the UTI akra we are type can so hasem nti the chane say the kan die strictly by sex be ma ne oba nkitahudi nti watu kwan ni broni bi akohia one channel ni de ni bi akohia wetuma fire ndi abagan na oba no bi beda be ma no nti those are the very same nya sa enema no.
So there's no way anybody can be born with such sicknesses.
Where they change me nchim kakra your congenital ones and it say the wo so it is there but yan mpempi no and na kwani so na or how mutahu your sites nji sa condition e kan gonorrhea chlamydia syphilis ye ta de wo pa very important so bisa titru oba bi ate o your banete wo so na unya nware ya na unya nware treatment free ho and they are all treatable so when treatment free ho net sound so a between the ama akra wo no tin kura pinanya and eye problems or otitis fancy omani yare omani so no ahyensuo prinsuo ni ade they are all due to this STIs nti encroach it of course congenital nti za kra nya na so being harvesters no nya it means any maame na e de ma no
ana ne papa nka hu
say on say on say have grace akra na da maame ne yem na se ho no fi feed no nti say ma papa nya na say oba ne kra ya na ntimi nya agi oba ne nya e na otwe de wo akra because of so few ase ho pia
because it's ohonoti
that's right na oba ne nini so fa ase ho na eba so that is why it me
wo bet tibi wo ho na mo be no mo ani e den sa
nti ma hwe couples are so say maame no obi papa obi nkra ni na nso obi